Okay, so this is the impact of psychological and clinical factors on quality of life in individuals with atopic dermatitis. So basically, atopic dermatitis or AD affects 2 to 10% of the adult population. Onset tends to occur in early childhood, but it may also occur at any age. Environmental factors and psychological stress have been implicated in the disease's aggravation. So basically, this article says that there's a lot of evidence um, showing that psychosocial, like showing the psychosocial impact of skin conditions. So it says that some studies suggest that AD patients experience a higher degree of anger, depression, and anxiety. Um, it says that many studies highlighted the impact of the disease on quality of life. Um, and many patients experience discomfort, pain, and inconvenience, along with consequences for their personal and social life and daily functioning. So, some studies have suggested an association between quality of life and disease severity. There has been a recent growing interest in identifying the mental factors that affect the psychological impact of skin conditions, psychosocial impact of skin conditions. In particular, the perceptions of stigma have been investigated and the factors that influence it. In one study, AD disease severity was associated with stigma dimensions of self-esteem. And so this contrasts to patients with psoriasis that really had no association between disease severity and like their stigma like perceptions, right? So these studies inspired them to explore this relationship between the severity and the stigma. So their methods. They had 131 people were recruited, but only 125 completed the measures. These participants participated like answering like these information like question things on the they participated to like give information on the National Eczema Society webpage and magazine. And so they had to sign a consent form. They had to self like rate disease severity, and they completed 5 like psychometric assessment measures, which was like basically the the dermatology life quality index tool that had like a 10 item self-report scale. So disease severities was assessed by asking participants to shade in like these 2 silhouettes of their body and like the areas that were more severe, right? And so the characteristics of the data were examined using descriptive analysis. Results. So in relation to mood, 46 to 14% of the participants presented moderate to severe like mood disorder. Their global self-esteem, in contrast, was like worse than the norms. So the results indicate that psychological factors like perception of stigma, depression, self-esteem, anxiety, fear of like negative attitudes and people thinking of them negatively were associated with quality of life. Disease severity was found to be significantly related to AD related quality of life and perceptions of stigmatization and depression. So this study highlights the important contribution to psychological factors um, to like AD related distress and quality of life. And so the negative impact of AD could be reduced by psychological interventions in addition to dermatological management. So like not just focusing on what skin looks like, but focusing on your mental like your mental health.